Hello everyone. Are you able to hear my voice? Am I audible? Am I audible? Okay, so you can ask your doubts in the chat box. You can ask your doubts in the chat box and I will try to answer all of them. We'll also study some important topics. Okay. So welcome everyone and so Rajveer Modi have asked that best strategy for the last 20 days. So the best strategy which I tell every time is MCQ practice. MCQ practice is the best strategy. Means just give more and more GTs and more and more questions of the question banks and do at least 500 to 600 questions in a day. That will create a momentum and you will minimize your silly mistakes. Only MCQ practice can do this. Ratification of theory is no use. Theory, I guess you must have read the theory till this time. Theory reading once is enough. Once or twice reading all the theory is enough. Now come to the questions because that is what you have to do in the exam. Okay, do more and more questions. These days also I am doing more and more questions. Give GTs every third or fourth day. Okay. So any doubt related to the strategy or any topic, you can just type in the chat box. Meanwhile, I am just starting the session and just reflect some important points. Okay, Rajveer Modi have asked one more question. After Marrow, which platform? Firstly, tell me, am I audible clearly or is there any problem? Am I audible? Am I audible? Type in the chat box. Am I audible clearly? Okay. So he have asked that after Marrow, which platform? After Marrow, Cerebellum is good, BTR is good. Okay, I have told multiple times that after Marrow, after doing Marrow, BTR will give you a boost in your marks. And some subject of prep ladder are best. Like medicine of prep ladder is better than the Marrow, and surgery of prep ladder is also better than the Marrow. Okay, so that is the thing, and let's start today's session. Meanwhile, you can just post your doubts for GT Marrow. GT solely from the Marrow. Give from Marrow only. Okay, so yes, you should be concerned about GT scores right now. GT score is true reflection of your final score. I am not saying a single GT score is good. Just take your 4 or 5 GTs, last 3 4 GTs, and see whether it is on an increasing trend or not. You have to figure out that is it on an increasing trend? Is your score increasing by 30 40 marks every week or every 15 days? Then it is a good thing. and if it is decreasing, then it's really a serious situation. Okay, so 20 days or 1 year, you have to choose one. Okay, so marrow GT score are good indicator of your preparation. Then marrow old GTs or cerebellum, new dams, new GTs. Which one to go for? Marrow. Firstly, try to do marrow new GTs. Okay, their level is good, and old GTs. Marrow 2024 to 25 GTs are very good. Then 22 to 23 and 23 to 24 are also good. Okay, so these 3 years GTs you can do from marrow. Cerebellum, I don't know actually. I have not tried cerebellum GTs. I rely solely on the marrow. Okay, just do one, take one platform and do it full and final. Means do its everything. Do everything of marrow. Do its question bank, do its theory, do its GTs. Okay, so I have done from marrow, so I can tell about marrow only. And I have done BTR. Okay, so those both things you can do. So question practice, at this I am stressing again and again, question practice at this time is very important rather than reading theory. Okay, so any subject related doubt you can also ask. Any subject related doubt. Do you able to recall whole BTR? No, I am not able to recall whole BTR, and nobody can do that. I recall 70 to 80% of BTR. 70 to 80%. And actively recalling is more important than just reading it. Okay, just give me 1 minute. We will continue our session and I will just speak out some important points. Hello again. Then we were on Disha's doubt. Disha is asking that what should be our strategy now? Can I use pearls as 20th book? Which pearls you are talking about? Marrow pearls. Disha, which pearls you are talking about? Firstly, clarify it. Then Happy Soul is asking, will the competition be as tough as in a set? Yes, the competition is tough because number of candidates are more. But again, I am saying that if you minimize your silly mistakes, don't see others. If you minimize your silly mistakes, then if you minimize your silly mistake, then your rank can be even in top 100 also. I have seen the candidates who have scored under top 100 rank in INISET. They were doing the questions which they were doing those questions wrong which I got right. जो मेरे क्वेश्चन जो है ठीक हो रहे थे, उनमें से कुछ क्वेश्चन उनके गलत हो रहे थे. मीन्स इट्स नॉट दैट किसी का कुछ टॉपिक्स में जो है मास्टरी होती है और किसी की कुछ टॉपिक्स में होती है. सो नेवर अंडर एस्टिमेट योर सेल्फ. The skill is to minimize the silly mistakes under the pressure of exam at that day, and that is only possible through MCQ practice, more and more MCQ practice, and giving more and more GTs. Okay, any more doubt you can ask in the chat box. Let's start the session. Okay, so this psychiatry is psychiatry is very important. Okay, every time four questions or five questions comes and every time four five questions come and then they are straightforward. So projection is when you are able to attribute your own wishes to someone else. That is projection. Then rationalization means making excuses for your behavior. Then displacement is shifting of emotions onto the another. Then OCD means in OCD there is reaction formation and doing. In phobia there is displacement. These all are defense mechanisms. Okay, then in grief there is denial. That is defense mechanism in grief. And in enuresis there is regression. Hello Chirag. Hello everyone who are the newcomers. They can press the like button and many more people will add to this live session. Press the like button and you can subscribe to YouTube channel. Then is the Cowden syndrome, Peyton gene. PTCH gene is Gorlin syndrome. In Gorlin syndrome we find BCC and the medulloblastoma. Then in CDKN2A mutation we find the syndrome associated is familial melanoma. Then is so you just try to see all the YouTube videos which I am YouTube video series which I am posting. I'm just explaining 20-30 MCQs which are high yield MCQs these days, and we will continue that series. And then is the PK is asking how to get under 20k rank, any practical strategy. You can get under 1k rank also. Okay, you can be in top 1000 ranks, you can be in top 1000 rankers. The strategy is MCQ practice. Doesn't matter whether you have read theory effectively or not. If you have done 50,000 MCQs, 50,000 MCQs, then you can definitely get in the top 1000 rank. 50,000 MCQs means Marrow Q Bank has 17,500 MCQs. Then Marrow GTs have rest of this 33,000 MCQs. Total 50,000 MCQs you should do before sitting in the exam. Okay, this happy soul is asking, surgery comes up with lot of TNM. Which one to must know except the breast? Okay, so one thing I want, this is a good question. One thing I want to tell is in the INISET and in NEET PG, the topics which are asked is quite different. In from surgery, the topics asked in the NEET PG are from urology. You remember that cystourethroskop question was asked, the device used to play the DJ stent. So cystourethroskop. Then again one question was asked in which there was a urethral stricture given, urethral stricture, and then it was asked that uh, which imaging technique you would do to diagnose it. Then retrograde uretrogram. Do you remember? So those MCQs were from urology. Then breast is an evergreen topic. Breast can be asked anytime and everywhere. Okay, then after that from surgery and this gallbladder, and this gallbladder topic is very important, means gallstones and bile duct. These are very important. Then next is, let me remember the topics. So breast endocrine, yeah, from do you remember those parathyroids question? Parathyroid is very important, even more than the thyroid. So that was endocrine surgery. Uh, then urology I told. Then uh, okay, so that those are quite less asked topics, such as stomach, small intestine. Rectum is asked more. Rectum is important. This fistula, hemorrhoid, these are asked. Okay. Okay, the PK is asking, should I write all explanation or avoid writing? It was taking load of time. Why you are writing explanation? What is the need of writing the explanation? You should write only one word. For example, in mistakes copy, after reviewing the GTs, you should write only one line for that question. Nothing more is required. For example, this single positive blood culture of Coxiella burnetii is a major criteria. In major criteria or Duke criteria for IE infective endocarditis, one of the criteria is single positive blood culture of Coxiella burnetii. Okay, then next is this Gettler's test. Gettler's test for drowning estimate the chloride content of the blood from both sides of the heart. So you have to write only one line. Then is this body packing, smuggling. What should be done? If a man is required from the airport, being accused of smuggling, and what should we do now? Do whole bowel irrigation. That is the treatment. So that one line is important. Okay, so so happy soul, why you are doing silly mistakes? Just read the question. This time in NEET PG we are getting 42 minutes for the 40 questions. 42 minutes for the 40 questions. Okay, so every question you can give 1 minute, and 1 minute is enough. If we know the answer, 1 minute is quite enough to answer the question. Okay, then let's talk about some important points. Okay, should I give UPSC CMS paper? When it is, I have not filled the form of UPSC CMS. When is this paper? Okay, PK is asking very good question. If I supposed to do 40 GTs, should I directly submit and review? Yes, you can do. That is the thing which I am telling again and again. You should give for new GTs 2024 to 25 के जो GTs हैं, वो तो आप प्रॉपर लैपटॉप पे बैठ के और लैपटॉप के सामने बैठ के आप 3.5 घंटे में दीजिए. बट द GTs विच आर ओल्ड सच एज 23-24 GTs, वो जो है you can just directly open them, submit them and review them. Okay, no need to attempt them because it will take much time, and review them those GTs. Okay, so UPSC CMS is on 20 July. Okay, so you can give then that exam. It's having MCQs only. So why you are fearing from giving that exam? Just consider it as another GT. This initial paper also I considered that it is like giving another GT. Okay, and everything went well. Why to just panic? What to do in last day? I was feeling so panic during last year. Why to panic? I am not understanding. This NEET PG or this INISET was nothing more than a grand test. That is why I am saying that give grand test every third day or fourth day. Give the grand test every third day or fourth day. So that will just remove your fear. Okay, that is what is that? What is NEET PG? A bunch of 200 questions. Okay, bunch of 200 question and you have to just get it to the right answer. Enough time is there. There is nothing to fear. Okay, then is the ping pong ball appearance on Gomori methenamine stain. These stains are also very important. Pneumocystis xerovecii. Then pin index, oxygen 25 and 2035, air is 15, CO2 is 16, Antonox is 7. These are the pin index safety system. Then is the torture methods. Phalangeal bastinado is striking the soles, beating on the soles. Then telephono is repeated slapping on sides of head. This leads to the rupture of tympanic membrane. Telephono. Then chapuva is tying the thigh and legs with bamboo sticks. Then jack or parrot perch. It is specific position, jackknife position, which causes positional asphyxia. Then is sawhorse, forcing the victim to straddle on the bar. Then wet submarine is immersing the head in water. Dry submarine is tying a plastic bag over the head. Okay, let me take your more doubts. PK is asking if I do only questions, what to revise at last? BTR. Revise BTR at last. For those who are just in the live session, 9 people are in the live session and only 2 have liked the video. Okay, so just like it so that it reaches more and more you are asking the doubts, more clarification you will get. Sir, should we go? Anushka Srivastav is asking, Sir, should we go through all questions after completing each set or only review wale questions? You should review all questions. For example, I tell you that this pilot or mariner whale appearance that is seen in paracoccidioides. So paracoccidioides. So with that explanation, maybe you have got it correct. But in explanation, you will find 3 more things. You will find coccidioides. In coccidioides, appearance is like a spherule filled with the endospores. Then you will find the blastomyces in the explanation. It is having the figure of 8 appearance. Then so you should read such points and add in your mistakes copy. Okay, so let me ask some questions from you guys and you try to answer it. Okay, in the chat box you can write the answer. Okay, tell me which position is which position. One second. Okay, tell me the 2 amino acids which are purely ketogenic amino acids. Purely ketogenic amino acids in the chat box. No one knows it. So why anatomy is asked more in the NEET PG? Very good, Samyak. Samyak have got correct answer. Leucine and lysine are purely ketogenic. Do you know that many questions were asked from anatomy last time? You can't ignore these subjects: anatomy, physiology, and biochemistry. Okay, tell me. One second. Okay, this just see that beauty of them. This Vibrio parahemolyticus question was asked in NEET PG 2024 and now it was asked in INISET July 25. Okay, tell me that boggy inflammatory mass. What is the diagnosis? Boggy inflammatory mass, thick crusting of the hair. What is the diagnosis? Boggy inflammatory mass and thick crusting of hair on the scalp. सो दैट सिर्फ इतना ही बताया जाएगा क्वेश्चन में. यस, वेरी गुड, सम्यक करेक्ट आंसर. कीरियन इज द करेक्ट आंसर. आफ्टर दैट टेल मी this one second. You can ask your doubts in the chat box also, okay? Meanwhile, I am asking the question. Okay, tell me which why I'm getting these questions. Okay, regular stride is seen in regular stride. Regular stride. Regular stride is. No one knows it. Yes, Goldstone Elias. Tell me, PK is asking, should I focus more on the GTs or PYs modules? Do both of them. PYs are necessary. You can't sit in the exam without doing PYs. After doing PYs, do the GTs. Give complete GTs of 200 questions and see where you are standing. Add 30 or 40 marks to your GT score. That will be your NEET PG score. Add 40 marks to your NEET grand test score. That will be your final GT. That will be your final NEET PG score. Okay, Anushka Srivastav is asking a question. Sir, please reply my question. I'm asking for the main exam. Should we go through all questions again? No, you should not go through all question again in last 10 minutes. That is a big mistake people do. They just review the questions again in last 5-10 minutes and they change the answers. That is a big mistake. You should not change the answer once you have. Just think about it, about the answer, and attempt it. Okay, you just, there are 40 questions. You go to first question and you just think about it, take 1 minute and answer it, then move to second question, then third, but don't come back if you are at last 5 minutes are remaining. So what people do is they just review all the question again and just haphazardly they change the answers of some question, and later then they find that they got them wrong. Haphazardly changing the answer is a big mistake people do. Okay, you should not review the answer in last minutes. Just do it, means think about it, take 1 minute and then attempt it. No need to review them again and again. Ananya is asking, sir, how to get in top 10k for a person who hasn't studied well before. In top, you can be in top 5k also. The difference is question practice. In the start of the session, I told all of them that difference is only of question practice. The person who is getting 10k rank, he have done only 20 to 25,000 MCQs, but the person who is getting under 1000 rank, he has done 40 to 50,000 MCQs. Do question practice again and again. And PYT की ये time हो गया है. Should I see them again? Yes. What is the use if you are not remembering them? This time just revise the BTR. For the theory purposes, revise the BTR. No need to revise the main notes at this time. Revise the BTR, then whole day you just review the MCQs, do the question practice. That is enough. Okay. Okay, you can ask your doubts. Let me ask more questions. Then tell me, inability to open the eyes. An infant is there who is having inability to open the eyes, excessive watering, and hazy cornea. What is the diagnosis? Infant having inability to open the eyes, excessive watering, and the hazy cornea. What is the diagnosis? Welcome, Anushka. Yes, I am trying to make more expected question series of MCQs. No dream stream, it's not ophthalmos, it's congenital glaucoma. Inability to open the eyes, excessive watering, and hazy cornea. It's a congenital glaucoma. Then tell me about okay. Uh, yes, I will try to make more expected MCQs videos and post them every day. Tell me that okay, one question, it's very good question. Is posterior longitudinal ligament pierced during lumbar puncture? Yes or no? Is posterior longitudinal ligament pierced during lumbar puncture? Yeah, very good, Diksha. It is not pierced during lumbar puncture. So structure which are pierced during the lumbar puncture are skin, subcutaneous tissue, supraspinous ligament, interspinous ligament, ligamentum flavum, dura mater, and arachnoid mater. Okay, next, tell me the order of ligating the arteries in PPH. Order of ligating the arteries in the PPH. So let me tell you, first is the uterine artery which will be ligated, then ovarian artery, then internal iliac artery. Then tell me about what is the complication of transverse vaginal septum? Complication of transverse vaginal septum. Anybody knows it? Yes. Uh, Complication of transverse vaginal septum. Endometriosis. It's not inability to conceive. The options were having endometriosis and PCOS. Then, so endometriosis is the answer. What is the treatment of bupivacaine-induced cardiotoxicity? This treatment of bupivacaine-induced cardiotoxicity. Okay, the treatment is CPR along with 20% intralipid injection. CPR along with 20% intralipid injection. Okay, these two things are asked again and again: superfecundation and superfetation. If there is if the female conceive in same menstrual cycle by two different act of coitus, then it is superfecundation. If the female conceives in two different menstrual cycles, then it is superfetation, which is not possible in humans. Okay, then tell me about omphalocele is associated with which syndrome? Omphalocele is associated with which syndrome? Why Down syndrome? Who told you? No, Down syndrome is not the answer. Omphalocele, hemihypertrophy of the legs. Beckwith-Wiedemann syndrome. Very good. Dream Stream have given it the correct answer. Omphalocele associated with Beckwith-Wiedemann syndrome. Then tell me about what is the in radiology image or ultrasound image you are getting comet tail artifacts inside the gallbladder. Comet tail artifacts inside the gallbladder. What is the diagnosis? What is the diagnosis? Muhammad Mustafa, tell me the complete answer. What adeno? Adenocarcinoma? No. Tell me the complete answer. The comet tail artifact inside the gallbladder. Yeah, now it's correct. It's the adenomyomatosis of gallbladder. Adenomyomatosis. Okay, the next is some scores. First is the CHAD S2 VAS CS score. This is used for risk of stroke in the patient with atrial fibrillation. Then is the CURB 65. It is used to predict mortality in CAP pneumonia. Then Apache 2 score. Apache 2. It is used to predict the ICU mortality. Then ABCD2 score. ABCD2 score. It is used in transient ischemic attacks. Tell me progesterone is added for minimum of how many days? Progesterone is added for a minimum of how many days? Progesterone. 12 days, not 21. 12 days. Treatment of rapid cycling disorder. Okay, if there are four or more four or more mood disturbances in a year, then it is rapid cycling disorder. What is the treatment of rapid cycling disorder? What is the treatment of rapid cycling disorder? Why paroxetine? No, paroxetine is not the answer. Valproate is the answer. Okay. Then tell me, if there is positive trans illumination test, there is macrocephaly, there is cystic expansion of fourth ventricle. What is the diagnosis? Positive trans illumination test, macrocephaly, cystic expansion of fourth ventricle. What is the diagnosis? What is the diagnosis? It's the Dandy-Walker malformation. Dandy-Walker malformation. Cystic expansion of fourth ventricle. Yes, Dandy-Walker. What I have seen is radiology questions are also asked in NEET PG and they are quite easy. Do you remember the ring enhancing lesion which was asked? If the ring enhancing lesion is there and along with it there is fever, then is the cerebral abscess. If there are multiple ring enhancing lesion with the scolex, then it is neurocysticercosis. If there is ring enhancing lesion more toward the center, which is more toward the center of brain, then answer is toxoplasmosis. If there is ring enhancing lesion, so you have to see the history first. These were asked in NEET PG 2024. Okay, then tell me about. Okay, program logo is very important. PK is asking, should I watch MCQs discussion videos? Yes, you can watch, but doing the MCQs will be more beneficial rather than watching the videos. Just do the MCQs and you will discover your own method of solving the MCQs. Okay. In NEET PG, there are more conceptual questions. Like this video again, I am asking so that it reaches more and more candidates. If you are in the live, just like this video. And after this, we will post this doubt session video on the YouTube channel. Whenever you are free, you can watch it. And we will also upload more NEET PG MCQ discussion videos. Okay, more NEET PG MCQ discussion videos, expected MCQs videos. Just see them and you will, maybe you grab some questions correct from there. Okay, we are also trying to just make some more videos which are having some frequently asked questions in NEET PG, frequently asked topics such as the program logos of the PSM, program full forms, and identifying the programs. For example, the if I ask you guys that in the question it's given that installments 5,000 rupees is given in two installments to the mother after the immunization of the baby, which is the program which I am talking about. 5,000 rupees are given in two installments to the mother after the immunization. Yeah, very good, Diksha. Pradhan Mantri Matru Vandana Yojana. Then free transport services, JSSK, Janni Shishu Suraksha Karyakram. Then Lakshya program, quality of care in labor room and OTs. We will discuss them in detail. The frequently asked topics. Okay, those, if we get those question correct, then we are getting high chances of securing a good rank. We can't get them wrong. Okay, so just keep doing more MCQs, more and more MCQs. No need to read long theory in these 20 days. Do BTR, keep doing more and more MCQs. Okay, that is the strategy. Okay, thank you for this joining in this video, and we will try to post more videos. So I'm closing this live now. Do 500 to 600 MCQs every, do 600 MCQs every day. Okay, thank you for joining.